Feeling worse after a B12 injection when you were expecting to feel better. It's confusing, it's frustrating, and you're probably wondering whether something's gone wrong. In this video, we're going to explain why this can happen, what's normal, and, importantly, when you need to seek medical help. First, it's worth saying feeling worse after a B12 injection can happen for some people, though it doesn't happen to everyone. If you're experiencing this, you're not alone. But it's always worth speaking to your healthcare professional if you're unsure about what you're feeling. So why does it happen? If you've been living with a B12 deficiency for a while, your body has quietly adapted to functioning without enough of it. When you receive a prescription hydroxocobalamin injection given by your healthcare professional, it can trigger a wave of metabolic activity as your body starts putting that vitamin to work. That sudden shift can temporarily cause symptoms like fatigue, headaches, or a general feeling of being unwell in some people. There's also what happens at the injection site itself. Pain, redness, or tenderness in the area is common, and for most people, it settles within 24 to 72 hours. One thing that's worth knowing, hydroxocobalamin can cause a harmless pink or red discoloration of your urine. It looks alarming, but it's a known effect and nothing to worry about. In some cases, particularly where deficiency has been more severe, the body can begin producing new red blood cells quite rapidly. This increased demand can temporarily affect levels of other nutrients, particularly folate and iron, which may contribute to how you're feeling. Recovery does tend to follow a fairly predictable pattern. Blood cell production usually begins to improve within the first few days. Hemoglobin levels can take 1 to 2 months to normalize, and if there's been any neurological involvement, things like tingling or numbness, that recovery can take considerably longer, sometimes several months. A few things worth discussing with your GP, practice nurse or pharmacist. Mention any side effects you're experiencing. They can check whether your folate and iron levels are where they should be, since these nutrients work alongside B12. And please don't change, delay, or stop your injections or any supplements without advice from your prescriber first. Now, when should you seek help urgently? Most post-injection symptoms are mild and short-lived, but some signs need immediate attention. Call 9999 or go to A&E if you develop sudden difficulty breathing, wheezing, hives or swelling of the face, lips, tongue, or throat. These could be signs of a serious allergic reaction. Also seek urgent care for chest pain, severe weakness, or any neurological symptoms that feel new or are getting worse. These are not typical adjustment responses and need to be assessed without delay. For non-urgent concerns, contact your GP or call NHS 111. If you do experience side effects, you can also report them via the MHRA Yellow Card scheme at yellowcard.mhra.gov.uk. There's a link in the description below. So to recap, feeling worse after a B12 injection can happen in some people, and it often reflects your body adjusting to replenished vitamin levels. Common side effects like injection site discomfort, headaches, and fatigue are usually mild and temporary. Recovery takes time, and that timeline varies. Always speak to your healthcare professional if you're unsure about what you're experiencing, and never change your treatment without their guidance. This video is general information only and isn't a substitute for personalized medical advice. Always speak to your GP, practice nurse, or pharmacist about your symptoms and treatment plan. Have you experienced unexpected symptoms after a B12 injection? Let us know in the comments. Your experience might help someone else feel less alone. If you found this useful, give it a like and subscribe to the Bolt Pharmacy channel for more straightforward health information.